Hi, I'm Zoe, the vet physio here at Fit Pet Physio. So welcome back to a journey through my dog's recovery from a cranial cruciate ligament injury. So I wanted to talk to you about a couple of things that we bought before surgery that we found really useful. So we bought a leg cover for Jack that was really useful the first couple of days. It made sure that we didn't have to take the plaster off for the full 2 days, and it also really helped to make sure that the wound stayed clean whilst the plaster was still on and no dirt got under the plaster or anything like that. We also got him a soft cone. The vets gave us a plastic cone, but he quickly found out that he was able to push that back by leaning it against the side of the cage. So we also got a soft cone to go over the top of it. It was just a little bit longer, and it also was a little bit tight around his neck, so it prevented him from pushing the plastic cone backwards, so he couldn't do that anymore. But before his surgery, we'd done a bit of practice so that he wasn't worried about having that on his head at all, and he was quite comfortable with it, as you can see, quite happily taking treats, etc. Good. Wait. Yes, good boy. Yes, good boy. Yes, good boy. We also got a help him up harness, just the rear harness, because he already wears a harness. So this just helps you lift them from underneath the pelvis. He is not a huge fan of it. He will stand with it on, he will walk with it on, but he doesn't really like being lifted with it. So we've still just been sort of carrying him, but it's really useful for if we were out walking, if there's like a pavement that he needs to go up and down, anything like that. I also got him a calming collar for when he can go out on some more walks, just to help calm him down, make sure that he's not anxious about going out, anything like that. We also got some calming sprays for the house, for the vet visits, so the wipes for the vet visits. This is in the living room where his cage is. And then the wipes, like I said, for when we go to the vets, so that he feels a little bit better. And then also some calming spray for if and when we need it. Hopefully we won't need it. once we knew that Jack had ruptured his cruciate, the vets gave us some medication to give him every day. So before his surgery, he had medication and supplements every day. He has a hemp oil supplement in his breakfast. He also has Metacam in his breakfast. He's been on that a couple of years since he was diagnosed with arthritis in one of his toes on his front left foot. He was also having half a paracetamol in the morning and half in an evening, which I have to give him in a spoonful of his food because otherwise he just won't eat it, which you'll see at the end of this video. He also has green lip muscle supplements, which are useful to help with cartilage degradation to make sure that his arthritis doesn't get any worse. He also has a turmeric glucosamine chorodontine joint supplement tablet, which are in little capsules that I have to break up for him because he wouldn't eat them otherwise. I have tried him with the golden paste and stuff in the past, but he just pushes it around and then won't eat his food. So this was like a compromise that he will eat. He has fourth grade food, so it's quite wet, it's quite easy to mush all the powder into that. He also has a seaweed supplement just to help with his teeth to make sure he's got no plaque on there. And he also has some salmon oil. We also did some pre-surgery vet physio with him, just to make sure, one, he's used to it anyway, but two, to make sure that he was as strong as he could be before surgery, because obviously he wasn't walking very much. He was maybe just doing a couple of short walks the week before, so he'd go out for maybe 5-10 minutes every day, but that was pretty much it. So we did pulse mag mainly to his left stifle, which is the one that he has ruptured the cruciate in. It just helps to reduce pain and keep him a little bit more comfortable. We also did some weight shifting exercises and some passive range of motion just to make sure that he was happy putting weight on each leg, that he was used to me lifting all of his legs, used to the movement of his joints, and to make sure just because he wasn't doing as much walking that he was still getting the joint motion that he needs to prevent any of his arthritis getting worse.